We're here today to talk about establishment of breastfeeding and continuation of breastfeeding. Our professional organizations recommend breastfeeding exclusively for 6 months and to continue breastfeeding for at least 12 months or as long as mutually desired by mother and infant. Your breasts, you may notice, are making changes during pregnancy to prepare you for breastfeeding. For example, initially the breasts are often a little bit sore or tender, and the area around the nipple will become darker. This is so that your baby can easily recognize the nipple as they are able to see contrasts when they are first born. The amount of milk that you produce initially is actually pretty small in volume. The initial milk we call colostrum, and this milk is heavily concentrated and packed full of antibodies and the perfect nutrition that a baby needs during those first few days after delivery. After the milk volumes increase, usually around the 3rd or 4th days after delivery, the volumes will increase according to your baby's needs. Some women have larger milk storage capacity, and their babies may feed a little bit less frequently and feed larger amounts. Other babies are feeding more frequently, and this is very common, especially during the first 6 to 12 weeks when your baby is establishing a full milk supply. Breastfeeding is not supposed to be painful. That being said, when a baby initially latches on, especially during the early phases of breastfeeding, it can be uncomfortable during the initial latch. So babies may make a smacking of their lips, and they may turn their head and open their mouth. They may show signs that they're interested in feeding, and we want you to feed your baby every time your baby shows those signs. We call them feeding cues. That being said, a baby will often cry if those initial feeding cues are missed. But crying for a baby who is breastfeeding at the breast is ordinarily a late sign of hunger or a sign that there's something else bothering the little one. So we want you to breastfeed as often as your baby shows hunger cues to breastfeed. When your baby is initially born, your baby may not want to feed immediately, but we hope your baby will feed during that first 60 minutes. Your breast will send a signal to your brain and your brain back to the breast that that your body needs to bring in a full milk supply, and your body is especially sensitive to these messages if you are able to breastfeed during that first 60 minutes. If you are separated from your baby for any reason, you can ask someone else who is with you to help show you how to hand express colostrum during that period so that your body will get that message started to bring in a full milk supply. After the first couple of hours at delivery, your baby will then be fairly sleepy during the next 24 hours. During this time, babies should still be feeding, but after that first 24 hours, babies will usually wake up a bit more and want to feed every 1 to 3 hours. Once you're at 12 weeks, your breast milk supply will likely be very well established. Your baby's needs for breast milk volumes will not increase usually after that point. Babies are very efficient at using breast milk, and at 6 months they will start to take in solid food to supplement their diet, and breastfeeding can continue during that time for at least 12 months. So cluster feeding is something that we use to describe where a baby will feed almost what may feel to the mom like non-stop for a few hours. This usually occurs in the evenings prior to bedtime. Babies will feed from one side and then want to feed from the other. They may rest for short periods of time before wanting to feed again. These cluster feeds are actually a good sign that your baby is vigorous and sending your body the signals it needs to send in order to bring in a full milk supply. Cluster feedings are especially common when your baby is going through a growth spurt, and they go through those growth spurts quite frequently during the first 12 weeks after delivery. Pacifiers can be used in the hospital if your baby is having a procedure done and they're wanting to soothe your baby. Pacifiers also teach your baby a different way to suckle, and we want your baby spending their suckling energy at the breast. So we want to make sure, if you're using a pacifier, that it's not used instead of breastfeeding as frequently and as long as is needed to bring in a full milk supply. Also, if you feel any pain or discomfort at breastfeeding after your baby has used a pacifier, it's best to wait on using the pacifier until breastfeeding has been well established. Many women who are having babies today will need to know that their baby can be safely and well fed when they are away from their baby, whether it be at work or for other commitments. If this is not the case, there's no reason that you have to teach your baby to take the bottle. However, if you do plan at any point to use a bottle, it's important that you teach your baby to do this during the first 6 weeks. In fact, I usually tell people at 2 to 4 weeks postpartum, once their baby is feeding well, that they introduce the bottle by pumping or expressing a little bit of breast milk into a bottle and having them feed that milk to their baby through a bottle. I would suggest that you continue feeding your baby about once a week, just to make sure your baby continues to remember how to take the bottle. So oftentimes when a baby is born, moms will want to start preparing for their return to work from day one. I'd encourage you to really take this time to be with your baby, to enjoy that time together, and not worry about filling your freezer with breast milk. I would, though, want to mention that you should introduce the bottle by 2 to 4 weeks once your baby is breastfeeding well, and use that bottle once a week in order to make sure that your baby is able to take the bottle easily when you return to work. Even taking an ounce or two in the bottle will be sufficient to keep your baby with that skill. About a week or two before you return to work, I would suggest that you do start pumping. You can pump or hand express, but most women find pumping with a double electric breast pump most efficient. Usually women are most receptive to increasing a little bit of their milk supply in the early morning hours. So I would suggest about 30 minutes after a morning feed that you try expressing some breast milk. If you don't get anything, no worries. Try again the next day. The pumping once a day will trigger your body in about 48 to 72 hours after that to make a little bit more breast milk. If you only get a half an ounce or an ounce, that's perfect. So we want you to go ahead during that time and save that milk and put that in the freezer. This milk that you're storing during those couple of weeks before you return to work can be used if the breast milk spills or if there's other problems that occur during the day. But ideally, the breast milk in the freezer will be there only for emergencies. When people return to work at 6 to 8 weeks post-delivery, usually the breast will need to be emptied every 2 to 3 hours in order to maintain the milk supply needed. This can be done by expressing milk either on the way into work with a hands-free bra that people can use in cars or even in public transit. The other times to fit in breastfeeding can be during a break, during lunch, and during an afternoon break, and or during the way home from work as well. The breasts are always making milk, and if you are concerned that you won't have enough milk when you get home, if you express milk on the way home, sometimes just expressing from one breast and then coming home and feeding the baby first from the fuller breast can be a nice way to do that. Another tip can be to feed your baby before you leave in the morning. Some babies can feed when they're half asleep. You can fill the baby up, and then the baby will continue sleeping for another couple of hours in the morning. Also, for people who are taking their baby out of their home to daycare of some sort, they can breastfeed when they get to the daycare. Allow enough time where you can sit and breastfeed your baby before you leave the daycare setting. And then as soon as you arrive towards the end of the day, let your daycare provider know that you will be hoping to feed your baby as soon as you arrive. So a couple words in closing. Although many women are worried about their milk supply as they return to work, other women will have an abundance of breast milk. Please consider donating your breast milk to a milk bank that provides breast milk for our most needy of babies in the intensive care unit.